So if I see a new glaucoma patient on a referral and that patient has any kind of symptomatic complaint regarding ocular surface, I'm going to make the workup a relatively parallel entity. We evaluate all the metrics in glaucoma, and then we evaluate the metrics within ocular surface. I will literally choose the pathway that I'm going to apply next based on the magnitude of the ocular surface disease, the patient's symptomatology, and the level of glaucoma. Recently, the LIGHT study has shown, I think, a very clear indication that laser as a first-level procedure, a first-choice procedure, is an excellent choice. And that has mitigated a lot of my decision-making in the last several months in patients with ocular surface issues, because I know that they will be made more complex eventually with topical therapy. And if we can avoid topical therapy or at least delay it, there's an opportunity to treat the ocular surface and then subsequently utilize medications maybe after a laser down the road in several years.
I think what's different is how we manage these patients, because we're all aware that as the baby boomers are kind of approaching this age now where they're basically at glaucoma patient age. You know, they're starting to get cataracts, they have glaucoma, their rate of ocular surface disease is increased. So we have an increasing demand for our services to address the problems of all these patients. And I think for that reason, we need as many eye care providers as we can, screening through these patients and evaluating who is at risk for each problem. But I think the important concept here is that in the past, I think we've often siloed it. We said, this patient has glaucoma, he just needs his eye pressure lowered. And that's all you worry about. That's what you kind of forget about every other issue. Or in the past, this is a dry eye patient, we're going to treat his conjunctiva in his cornea and outside his eye, and that's what we're going to concentrate on. But I think now we're able to be much more holistic in our approach, and that's the nice thing about working here in this practice with Jim, is we're really take a very holistic approach and address all the issues that individual may have. Starting with the ocular surface disease, if he has glaucoma, we can decide if medical therapy, and if it is medical therapy, what's the best medical therapy? Do we want to minimize his preservative exposure? Do we want certain active ingredients like prostaglandin analogs may be more deleterious to the eyelids than other drugs? So now we can do surgical options that we have with MIGS therapy, SLT. So we have a whole plethora of choices, and really going through and sorting through is essential. And so, as Jim was saying, ordering these tests early on, getting kind of a basic format of information from that patient, I think is very important, and then we can move forward depending which therapy path we choose.